This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D-HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning. Welcome to the show. Always a pleasure to have your company, and always here on the program, we do our best, as we like to call it, our mission statement, to help you and your family improve your overall quality of life. And we do that with a variety of information provided by Dr. Molly Fantasia, the PhD doctor, executive director, founder, and author of a new book, which we'll talk about later on in the show. Dr. Molly Fantasia is here. Like we said, she is the PhD doctor, founder, and executive director of Innovative Medical Associates, Marlton, New Jersey. At any time during the course of our show, if you have a question or you have a medical challenge you want to run by Dr. Molly, which a lot of people do here on the program, 855-839-1210 is the number. 855-839-1210. That's our number here in the studio. And again, it's Health Watch Sundays, 8 till 9 here on Talk Radio 1210, WPHT. Dr. Molly, Innovative Medical is different.
Oh, it's very
I guess that's the way to put it, right?
Innovative Medical is different in that it is a cooperative of a group of healthcare providers who have like-minded in our philosophy. We work out of my clinical area, which is a licensed primary care facility in Marlton, New Jersey. And we, by the way, we have patients who fly in from everywhere. So when I say we operate out of Marlton, it's irrelevant, man, because we run the borders. But what we are is, our philosophy is a little different in that, yeah, if you need a prescription, we're going to get you a prescription med. If you need hypertensive meds, you're going to get them. If you have a problem with an infection and you need antibiotics, we're going to give it to you. You need an antiviral, we're going to give it to you. But the object of what we do is we actually believe that by utilizing some of God's ingredients or natural substances, things like vitamin, minerals, amino acids that are effective, can be just as effective and help with people's condition and thereby reduce the need for the pharmaceuticals. Not throw them out. Don't throw them out. Reduce some of the side effects that they may cause.
You mentioned people come from all over. It's like that old line, spanning the globe.
Well, I don't know about the globe, but definitely spanning many parts of the U.S. I actually have people coming back right after Labor Day and then early January. I mean, they've pretty much scheduled their tune-up, so to speak.
So they come in from all parts of the country.
Right. And they may have been, actually most of them have already been seen by our physicians and have come in now to keep up their reserve, which is something we believe in doing.
You've often talked about your facility, Innovative Medical, and you've often said that it's different from a lot of other facilities that may do similar things.
Oh, yeah.
So can you explain what's different?
Because we use hydration as one of the vehicles by which we can effectuate change. That is, of course, we use our vitamins, our minerals, our natural substances, and sometimes even traditional pharmaceuticals. We'll deliver them IV, and that in turn then allows us to reach a therapeutic level much quicker than if you go to the health food store, you pick out a few things and you start taking them. I have a patient right now who's very knowledgeable. He's a great health food store advocate and provider. He's been in the business for a long time. He's knowledgeable, but you know how many times you walk in somewhere else and they're not so knowledgeable?
Exactly, yeah.
And that's really the key. The key is, and we also know that you can't effectuate the change as quickly enough if you take the wrong, let's say, type, or the type that isn't synergistic with other things that can actually effectuate the change that you're looking to do.
And many times you have had patients come in and say, gee, Dr. Molly, I'm not really feeling good.
I know.
And I'm taking all of these, and they bring in all of these.
Oh, we love that.
And 10 of them out of 12 are the same thing.
Exactly. Or they have the same constituents, but none of them equal a therapeutic level. That's really frustrating. Whereas people will come in with 10 vials that have certain ingredients. Many times the ingredients are actually repeated, but they still don't reach that therapeutic level that we can do in one hydration therapy.
So that's where you get the therapeutic, or you get the
Right.
That's the level.
Right. And so in our facility, most times, I'm not going to say all the time, but most times, a course of the hydration is extremely important in the therapeutic process for a patient.
How often or how long do people have to really get the hydration in order to see change?
Sometimes as little as 5 weeks. Most times it's between 10 and 15 weeks.
And what about maintenance schedule? Because here
Maintenance.
every week people...
Yeah, I know you in particular.
Right.
Ah, John, you still going there 20 years later? Don't you feel any better? You feel great.
Yeah,
I know.
I know.
Here's the deal. People really will help. We will help set them on a maintenance level. But the real key is people are going to feel it. And they're going to really say, you know what, Dr. Molly, you have me once a month. I think I ought to come in twice a month. You know how many times I hear that? So, again, I'm not big on beating people up that they have to come back. But we find that if people follow a regular regimen, they do 10 times better.
I know myself, if I don't come in, and sometimes, I
Oh,
can't
you
make
traveling, John?
Yeah.
Hey, listen, you're a big deal. We got to understand that.
Well, anyway, I miss, and then something doesn't feel
quite right.
Right, and that's what I was talking about.
And
right?
you know what, John? Today, in particular, all we're doing is hearing COVID. Now, you know how many traveling guys, I have a lot of entrepreneurs, right?
Sure.
They travel all over. Guess what? The minute they get off the plane, they're back in the chair. And you know why? They said, Molly, it's unbelievable. The recirculating air. Yeah, we have the masks. We have this. We have that. But when we're sitting and we're, let's say, at a new city, we start feeling a little run down, a little tired. And I know it's time to get back to you. Even if I'm away 2-3 weeks, I'm back right to you. And I really appreciate that, and my physician. So it's great.
And the thing is, and we talked about this during the peak of COVID.
Oh, yeah.
Well,
are we in a peak right now? I don't know.
Listen, depending on what TV show you watch, we're in a peak, we're not in a peak. And what happened is, and I felt as though the immune system was so strong, I never really worried about it, and I never had any kind of side effects or anything.
Well, I'm happy that you say that, but I also know you didn't worry about it because you followed certain real protocols that helped you through whatever. And again, I don't spit in the wind, as I say. I thank God. But, we were able to help people through COVID, and I believe we're doing it again, this resurgence. And we'll talk a little bit about this in the next segment.
We're going to be talking about this. And the key is you have said this virtually every show we've done, and you and I have been doing these kind of shows for years, that you've talked about the immune system and the importance of maintaining an immune system. You know
what? God's given us an innate ability to help ourselves, but we gotta keep it up.
And if we don't, then that's
where
when
you don't,
the problem
and listen,
comes in.
Sometimes even when we do, we need an extra boost. It's just the way life is as we get a little older, okay? Doesn't mean we have to jump right in the grave. No. I believe God's programmed us to live to 120. You hear me say that all the time.
I know. Quickly, before we go to our break, just talk for a moment about supplements. I know you do the hydration, but you do talk to people about things to take.
Oh, my goodness, of course. We go through an entire list. I have a new patient starting this week who has lupus. We asked her to please bring in all the supplements she's taking. And just in the initial conversation I had with her in the free consult, I realized she was taking a lot of things, but maybe some of them weren't appropriate for her condition. And I think we can improve that as well.
All right, we're coming up on our first break of the morning. Our program is called Health Watch, and we're here every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. You have questions for Dr. Molly, and we always tell you this, and believe me, people have been listening the last few weeks. We get the calls in. If you want to call, now's the time to do it, so we have plenty of time to talk to you. 855-839-1210. 855-839-1210 is the number. With Dr. Molly Fantasia, I'm John DeMasi. We return more of today's Health Watch after these words. Back here on Health Watch, operators, as per usual, are standing by right now at Innovative Medical Associates while we do the show. And in fact, they'll be there after the show is finished today. So if you have a question, you want to call them, you want to make an appointment with Dr. Molly, the number is 856-489-0505. 856-489-0505. That's the number. Innovative Medical Associates, Marlton, New Jersey. And the website is innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Before we get back into the show, in case you missed it last week, Dr. Molly has a new book out.
Oh, it's out, John.
I mentioned at the top of the show, she's an author. This is her second book, God's Ingredients TOO, My 30-Year Journey in IV Nutritional Medicine, available on Amazon and anywhere you get books. God's Ingredients 2, Dr. Molly Fantasia. You want to get that book, and kind of talks about a lot of the things we talk about here on the show. If you have a question right now for Dr. Molly, 855-839-1210, our number here in the studio. I know you wanted to talk about immunocompromised situations, Dr. Molly,
I
and
do.
they are many today.
You know, every time I turn around, we're hearing commercials about immunocompromised situations or immunocompromised. So several of our patients have asked our healthcare providers and myself, hey, Dr. Molly, what is an immunocompromised situation? Well, immunocompromised means anything that weakens our innate or our own body's immune system. They can be chronic, they can be temporary, they can be acute. And by that I mean a chronic immune system might be something that affects our immune system, might be something like an autoimmune disease, lupus, MS. You've heard me talk about some obscure ones last week. Well, there were many. The other thing is it can be a chronic kind of thing where you get something like fibromyalgia, which is actually comes about from a viral. We believe there's a viral component to that, and that it can be chronic, which means you have it all the time. Also, autoimmune, but a different, let's say, vector. Then you can have an acute situation where you get exposed to a virus and you get that virus. So what's like that? Shingles might be something like that. So there are many things that weaken the immune system. But what is the one thing we can do to keep your immune system in good working order, John?
Vitamin C?
You got it. Vitamin C. And vitamin C, in a way, that is therapeutic. And again, I'm going to say vitamin C has an antioxidant ability, and it also has a pro-oxidant ability, which means it can be utilized during certain types of conditions that you wouldn't think you utilize it for, like cancer. So it depends on what we want to do, but we definitely want to use vitamin C. We also want to deliver vitamin C in a therapeutic level. And how do I do that? Hydration. And the reason why I'm mentioning this is because every day we're hearing another thing about you go out, get your shot if you're immunocompromised, get your vaccine. Now, Dr. Molly is not an anti-vaxxer, but what I'd like to say is, wouldn't it be nice to keep your immune system tuned up,
right,
so that it accepts whatever way you want to handle the virus, i.e. this terrible coronavirus. So what are we doing? Well, we have a whole protocol to tune up the immune system, whether you're well or you're coming in and you have a problem, and we're using it as a treatment form to improve your quality of life. So it's twofold, John.
So if you mentioned a few things that compromise the immune system.
Yes.
You said fibromyalgia, and you said a couple of other things.
Yeah.
But is there anything that can compromise your immune system where you don't have any of those conditions? You're just like living your regular
colds.
life.
How about
Okay.
colds?
All right.
That's viral. That's one of the things I mentioned. Colds. Yeah, and people who are feeling just plain run down. Let me tell you something else. What do you think we all have that's a common denominator today in today's world? Begins with an S. Stress.
Oh, yeah.
Stress. It changes the hormonal cascade that we have going on. And remember, the hormonal cascade has to do with our immune system as well. So there are so many things. Like if your cortisol is running out of control because you're always on the go. I see that a lot with a lot of my entrepreneurs who travel a great deal. Because what happens is they're always in a rush in one way or another. Catching the plane, making sure things are in order. Now standing in the line to get onto the plane.
Yeah.
I mean, there is just so much out there that can affect our immune system. So some of the things that help, of course, vitamin C being a big one. But guess what else, John? I use something called quercetin. Quercetin is a flavonoid. We extract it from red onion, but it's in other fruits and leafy vegetables. So that's something that we use. And again, we use it in a therapeutic level. We also use things like lactoferrin. You've heard me talk about that.
Yes.
Yes, we give people transfer factor if they need it. That's oral. But we also look at lactoferrin because lactoferrin is a natural immune enhancer, and it's in newborn babies. So that mothers give it to the newborn baby. So guess what? It's good for us even when we're old babies. So these are the kinds of things. Vitamin D. How many times do we test vitamin D level? And we test it routinely, which, by the way, most primary cares do test, but they don't test routinely. And I'm a firm believer, as again, I'm a biochemist. I look at the reference range for vitamin D, and I really believe it's way too low. Way too low. I think people need a lot more vitamin D3 and a good form of vitamin D3, and we have to test for the appropriate vitamin D3 when we're looking at it.
You mentioned tuning up people in the immune system, and you mentioned a whole protocol now. Is this something that you're recommending people do, particularly since we're hearing all about Delta variant and COVID and all this stuff?
It's a funny thing. I have some very fine patients. One of their wives called this week. I'm worried to death, Dr. Molly. I need to know if I have the antibodies. Do you have an antibody test? Yeah, I have an antibody test. Well, if you're that worried, sure, come in for the antibody test. But you ought to sit in the chair for what? An immune-enhancing therapy, and then you won't be worried so much about your antibody test. Am I right?
Yeah.
Okay, because her husband knows to do that because he's a busy executive, highly functional, and he said, you know what? I agree. I know I had COVID. Okay, no problem. I just know I need to be tuned up now. Makes sense.
So you're talking about something, sounds like to me, preventative medicine here.
Well, I'm not a medical provider, but I sure help our medical providers and our healthcare practitioners to indeed help prevent. And actually, the name of our facility is Associates in Preventive Medicine,
right,
as you know.
Right.
So, yeah, of course, my whole idea is why not keep ourselves as tuned up as possible? We spend more money on our cars, keeping them in great shape than we do on our bodies. How crazy is that?
I believe that.
I know you do, because I know you're very particular. You get that oil change, you bring in the tune-up, you get the checkups, even if there's nothing wrong.
Exactly.
And today, on our new fancy cars, it comes up on the computers and says, oh, you're almost at your 30,000-mile checkup. How's about us?
Yeah.
How's about you and me getting a 30,000-mile checkup?
Exactly. It's funny because you and I drive the same type car, and it's the same thing. It comes up. It constantly comes up.
Right.
It tells you 5,000 miles before.
Right, and it tells you your oil level. Well, guess what?
Exactly.
Come on into Innovative, and we're going to tune up that oil level because we all need it. And for us, we have to oil our joints, right? What is that? Collagen. Our skin. Just all of these things contribute to our overall well-being. And if we don't worry about it, guess what? No one else is going to.
So would you suggest that people do this now as as we're constantly talking about.
Sure, COVID.
Delta variant.
Yeah, what is it? It's a virus.
Yes.
I said viruses will actually bring down your immune system. And you can have chronic viruses that stay with you, like CMV. And just look it up, folks, as CMV. Don't worry about the technical name. CMV, people have it. It causes fatigue, muscle aches, this kind of thing. It's not COVID. How many people did I have come in and think they had COVID, and really they had something that contributed to fibromyalgia, chronic fatigue?
Right.
You know how many? Too numerous to count.
I know.
Okay. And how about other things like shingles? Yeah, okay, shingles can be prevented by a vaccine. Sure, it can be. It also can be prevented by keeping your immune system up.
Yeah.
So there are so many things that we are exposed to. How about hepatitis? That's the newest thing. Hepatitis is running rampant under people our age, right? Undetected. A, B, and C. Guess what? You need to keep your immune system up. I can't tell you how many patients I have who've come in and said, well, I had to get treated with the hepatitis drug, which, by the way, is pretty tough on you. Yeah, I know. And what are we doing? And the guy said, well, you really ought to go in and get some vitamins and things to clear out the liver, like glutathione.
Right.
No question. That's from The Cure, folks. From The Cure.
Yeah.
Okay?
Okay, we are at the halfway point of the show, which means we're coming up on a break. But there's plenty of time for you to call in if you have a question or a medical challenge you want to run by Dr. Molly. 855-839-1210 is the number here in the studio, 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. And I'm John DeMasi. We return more of today's Health Watch after these words. Back here on Health Watch, operator standing by right now at Innovative Medical Associates, 856-489-0505 is the number. 856-489-0505. You want to call and get some information, they'll be happy to give that to you. And you want to make an appointment to sit down with Dr. Molly. Remember, the initial consultation is complimentary. It's very simple. You call and you make that appointment, and then you meet Dr. Molly. You can find out a lot more and really get a lot of your questions answered in person. That's the best thing you can do. 856-489-0505. The website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And a quick reminder that if you miss any of today's show or you like it, you want to hear it again, well, you can do that. We have our Health Watch replay every Sunday 4 until 5 here on Talk Radio 1210 WPHT. Again, our show is Health Watch, Sundays 8 till 9, our live version, and our number here in the studio, 855-839-1210. As we always tell you, if you want to call, now's the time to do that because we want to make sure we get your call in. We get calls at the end of the show. We have a minute left. We can't take your call, all right? We don't want to get you shut out, all right? 855-839-1210. Just finishing up, Dr. Molly, on the immune system that we were talking about.
Sure.
In general.
And I think the best thing for me to say is what we want to do is we want to support your immune system. That is the whole point of when we talk about prevention. We're actually saying what we want to do is support the immune system that God has given all of us. And in doing so, it will really make a difference in your quality of life. And that's really where I focus, because you can have all of the gold in the world when you don't have a quality of life. And my patients are the ones who've educated me in this. They're high, functioning folks. And they say, Dr. Molly, if I didn't do this, I don't think I could be as high functioning. And for me, that's the best kind of data I could ever get. All the blood tests in the world don't tell me what my patients tell me.
And that's why you've got to maintain your immune system.
Absolutely.
Because that's really your defense.
Exactly. And it keeps you going through thick and thin. And God's given it to us. It's a gift. And what we want to do is keep it going.
All right, 855-839-1210, our number here in the studio. I know you wanted to talk about, you have a new patient with
starting this week on Tuesday.
With
and
lupus.
She's, very lovely girl.
What is that?
Lupus is another autoimmune disorder, and it's very interesting because the telltale sign is usually a butterfly type rash. The rash looks like a butterfly. Sometimes, most times it's on the face, but it can be on the back. It can be elsewhere on the body. So you would say lupus only affects the skin, right? No. Lupus is a bad kind of condition. And I'm using the term condition as opposed to disease for a reason, because I want our patients to learn to live with lupus and live well. So it can affect body aches, it can affect skin, it can affect joints, but more importantly, it can affect your internal organs, like your kidneys, like your GI tract. So it can be mild, which means you only see the rash on the outside, but what's going on the inside can be more severe. So for a patient like this, not only are we going to use vitamin C in her particular hydration protocol, we're going to use some other things, including some homeopathics that can help re-regulate pain and joint. We're going to probably use collagen. We're going to actually deliver collagen hydration. We're going to deliver some things like the glutathione and the alpha lipoic acid that you hear me talk about. We're probably going to also deliver some grapeseed extract. You're going to say, what? Why are you going to do that? Why?
I was just going to ask you.
Because it's high antioxidant, and synergistically it will work well with the quercetin and the vitamin C. So there are many things. We're going to go through her vitamin list because I understood she didn't bring them in, but she told me that she actually takes extensive amounts of vitamins, and her husband has been very proactive in helping her, which I thank God. By the way, she's a nurse, and she's a wound care specialist and an ostomy care specialist. Can you imagine the stress she has?
Oh, yeah.
Right? Smart girl. So, am I committed to helping her? You bet. Is my staff committing to helping her? Yes. And what's the best way for us to help her? It's through the hydration, and then also through utilizing some of the other things we have. You know, we have certain instrumentation that I don't even talk about. You know, I have a light therapy, right?
Yes.
That may be something we want to use on her, but we have to do it judiciously because we can't affect the skin. So there's just so many things. And again, this is where my physicians come in as well as my protocols. But she's got a particular condition that I believe we can see a little difference in probably as short as 5 weeks. But someone like her is going to need 30 treatments, there's no doubt. No doubt.
Is this something that is preventable? Like
no, it's autoimmune. It's just like things. You know, some of this is just the luck of the draw. Now, you know, I believe in epigenetics as well as genetics. But you know, she has made changes in her life already. It's just that what we want to do is we want to sort of put the high test in. That's really what I'm doing. I'm putting the high test in and helping her with things she's already done because she's a nurse, smart enough to know. Take some supplements. You know, the drugs that they put you on for many of these autoimmune. Look at MS. I have a physician who has MS, right?
Yeah.
These are high functioning folks, right? How's this happening? So the drugs are very, very toxic on the body. So they're smart enough, these kind of people are smart enough to know, listen, the drugs will always be there, and maybe I can use a lesser dose if I follow some type of hydration protocol till then.
Which is your philosophy.
Exactly.
Which you talk about at the beginning of every show.
Exactly. The short answer is the drugs will always be there. The idea is, do we need to bring out the big cannons, or can we do it with the small handgun?
and
there's the answer.
And many of the drugs, as you've talked about,
hard.
You can't function.
Many
it's
times.
It's really hard.
Listen, it's like the rheumatoid arthritis. You know, rheumatoid arthritis is another autoimmune disorder. People don't think of it that way, but rheumatoid is. It affects skin. It affects all the joints. It affects muscles. I mean, it's tough. Sandy, my patient, who is a retired school teacher, look at the stress she was on. She taught special needs, actually. And so when you think about it, here she is in her early 70s, I would say, if that, maybe she's 69. the condition that she has is unbelievable. And she does say, man, when I come in, I get some relief. Is she perfect? No. There's not a cure for what she has. They can put her on some dastardly drugs. And everybody knows the IV drugs that they want to put you on, terrible. Really tough.
So it goes back to, as I said, your philosophy of the least amount of pharmaceuticals possible or necessary
to effectuate the
Right.
change you need and maintain your quality of life. That's what we can do. And I will tell you that I think we have a lot of success with that. And I've certainly seen it through COVID as well. How about the long haulers? Talk about autoimmune. The long haulers post the COVID.
We talked about a patient that I was talking to
My
a few weeks
God.
ago. And she said prior to coming into your place that she had no quality of life at all because she was a long hauler with COVID.
Exactly.
And it was young. I mean, she wasn't. I thought she was in her early 30s.
If that.
Yeah. And
two little kids.
And age doesn't have come into play at all with this.
No. You know, the idea is, listen, I've had a patient who was 101 who actually, God rest her soul, she died at 102. Okay? She had an immune system at 101 that people in their 50s and 60s would have killed for.
Right.
Okay?
Yeah.
And she wouldn't have probably passed away if she didn't have an accident. Okay? It was unbelievable. So, yes, there are things we can do for longevity, but good longevity. In other words, quality of life.
People always ask you, usually in the initial consultation, they'll say, well, Dr. Molly does this work.
Come on out on the floor.
And you usually say, well, let's go out on the floor
and talk
to patients.
Right. You can't. Listen,
and that's really what happens.
Listen, my patient population is a thinking population. They think out of the box. They're usually highly successful. They're smart people, men and women, smart. And they professional and entrepreneurial. And then they'll tell you what they went through before they got to me. Cancer patients, survival. Oh, my goodness. Oh, the oncologist said, you're just wasting your money. Yeah, okay, if that's what they want to believe, the oncology people, okay, that's fine. My patients will tell you they feel better through conventional treatment. They're doing well. And, the old myth about you're going to just really urinate out all your vitamin C. You're going to urinate out the extra vitamin C. But we're going to deliver a level that is going to reach the organs in question and do. And we prove it at the end of every drip.
You've often talked about reserve.
That's right.
And,
we need
and
that
that's
reserve.
a lot of times what is happening.
Right.
You're building up your reserve.
Exactly. And so what is wrong with that? It's like having an extra tank of gas that you have for a long haul.
Right.
And that's the
Right.
bottom line. And as far as I'm concerned, you want to live a great quality of life while you're here on Earth.
All right, we're coming up on our final break of the morning, which means you still have time to jump in with a question or a thought for Dr. Molly at 855-839-1210. Our show is called Health Watch. We're here every Sunday, 8 till 9 on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. And again, if you have a question, you have a medical challenge, anything at all you want to run by Dr. Molly, this is the time to call in, 855-839-1210. We're coming back with more of today's Health Watch after these words. Back here on Health Watch, as always, operators are standing by at Innovative Medical, and just because we leave you at 9 o'clock doesn't mean they go home. No, they'll be there. 856-489-0505. 856-489-0505. That is the number for Innovative Medical Associates, Marlton, New Jersey. And don't forget their website. A lot of good information on that. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. And don't forget Dr. Molly's book, God's Ingredients TOO, My 30-Year Journey in IV Nutritional Medicine. Dr. Molly's new book just came out, available on Amazon and anywhere you get books. Feel free to pick that up and kind of get you started on this whole process of understanding what Dr. Molly does. Right now, we have a couple of minutes left of our show. If you want to jump in with a question here on Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. Frank is in the great Northeast. Frank, good morning. You're on with Dr. Molly.
Hi, Frank. How are you?
Good morning, Dr. Molly. Good morning, John.
How are you,
Dr. Molly,
Frank?
I was planning on calling you next Sunday with to tell you what happened, but you said something that startled me a little bit there. Tomorrow I'm starting IVIG. They're giving me Octagan.
Frank.
And you said
Frank,
Stop a second. Stop.
Frank. Dr. Molly wants to talk a little bit about this. I didn't want to alarm you. I am not saying don't take the conventional treatment. You have several challenges, Frank. You need to get them under control. What I am saying, and what I'm saying to everyone, is you don't cavalierly go into taking anything, whether it's a pill or an IV treatment for autoimmune. You've got to realize there's going to be some side effects. Now, you're an intelligent guy, so you can't afford to be alarmed. You know that I have really told people to not stop their conventional treatment, and I am telling you that as well. Now you can go on, Frank, okay?
Go ahead, Frank.
Because I love you. I don't want you to do anything that's counterproductive.
Well, what I wanted to ask you was, besides what they told me to hydrate myself before we start, which I started yesterday.
Good.
I got different opinions about how much water to drink. I wanted to ask you about that. They said anywhere from 2 quarts to half your body weight in water. I'm going somewhere in the middle. What do you recommend about that?
I think they're right, between 2 quarts and half your body weight. I think you'll know after you're getting your first treatment tomorrow, you said? Is that right?
Well, tomorrow starts it. The first week is I'm getting 50 grams for 5 days, and next week I get 70 grams for 2 days.
Right. So you'll know, look, you got to go in, you dip your toe in the water, you'll know right away. If this works for you, this is like a God-given miracle. Remember, I believe God gives us an innate ability to heal, but sometimes we need a boost. So in your case, I think you just go in there, follow their advice, do what they have to do, and we will move forward with you, Frank. I certainly will help you any way I can. Thanks, Frank, for the call. God bless you.
All right, Frank, thank you. Appreciate
God bless you.
Jim, do we have Tim or do we have Catherine? Who do we have? Catherine in Chemung?
Hi.
Yes.
Catherine,
hello.
hi. Good morning.
Hi, Catherine. How are you?
Good morning.
Hi, Catherine.
Good. I'm doing well. I'm actually I'm the patient who's starting with Dr. Molly this week. I'm just really excited.
Well, Catherine, you're my potential patient, Catherine. How are you? You're the wonderful nurse I just spoke about. There's a gal.
Yes.
You see what I mean? Smart girl. Knew right away. Knew she has a challenge. And apparently, I wasn't there on Friday, but I heard your husband maybe came in. Is that right? Was that your husband?
Yeah, that's right.
Okay, cool. Yeah, and I was looking. I'm sorry I missed him because I would love for him to come in with you at some point during the treatment protocol, and we can sit and chat. But tomorrow, what we are going, well, you're going on Tuesday. We're going to actually start by drawing some blood. I want to check some immune markers, right? And we're going to put you in the chair as well, and you're going to get hit with some vitamin C. I believe certain amount of our homeopathics, and I really want to help you get this thing under control, Catherine. God bless you. You're a wonderful woman. I want to keep you in the workforce, darling. You know, nurses, we need you. We need you. God bless you. You have a question or anything for me, or?
Oh yeah, actually, because talking about staying in the field. I mean, I was actually looking into reading up more on homeopathic medicine.
Good.
And if you go on the internet, it's a plethora of information, and you don't know
some
what's
good,
and
some bad.
What's good and what's some bad. Yeah,
right. Some good, some bad. So that's where when you come in, and of course you were lucky enough to meet my seasoned nurse. I can't say the word for her. God bless her. But I am telling you, she will also be actively involved in what we're doing along with my doc, and we're going to get you going. I'm telling you, Catherine, that's a commitment I made to you when I saw you. You're a beautiful gal, and I know we can help you. John, wait till you meet her. She's a wonderful gal. John's there on Tuesdays as well, so it'll be fun.
Oh,
thank
okay,
you.
great.
All right.
It'll be good. Thanks, Catherine, for this
thank
call.
you, and good
you're
luck with
welcome.
everything.
Have a great day.
You too.
All right, thanks
God
a lot
bless
for the
you.
call.
That was a great call.
Yeah. I know you wanted to talk about minerals because that's part of your
I mean,
protocols.
Zinc is extremely important, and zinc is important for autoimmune and an immune system function. Very important, and God's given us these minerals. Also, selenium. People don't talk about selenium. Selenium is something that's very important for utilization of glutathione, which is utilized in the liver. So there are just so many things that we're able to deliver, John, that people don't realize, and trace minerals are one of it. The other thing is I talk about amino acids, as you know. Amino acids are extremely important because the body can't make some of them, and they're necessary for the overall functioning of a well-tuned immune system.
All right, we have another call. Let's talk to Tom. Tom, good morning. You're on Health Watch with Dr. Molly.
Hey, Tom.
Good morning. Just a question about a Mayo Clinic study. They said that 3 tablespoons of olive oil will stop the progression of heart disease and 4 tablespoons will reverse the heart disease. Did they indicate any limitation of times on those?
You know what? I don't believe they did. But I read that study, and do I agree with that? Yes. As a matter of fact, I'm a big believer. I have a particular olive oil that has come in from the Holy Land. This is crazy. That has 10 times more of the active ingredient in the olive oil. John knows that I'm a big believer in the olive oil. Now, I can't deliver that IV because it's too thick. So we put people on it orally, yes. So, Tom, take it. Are you worried about heart disease? You have heart disease in the family, or you? What?
I'm just trying to make sure that the items that I hear on TV and stuff are correct.
Sometimes, yeah. You know what? I agree with you because there is a plethora, as the young lady ahead of us said, of knowledge. Some of it good, some of it bad. But olive oil is something I truly believe in. Of course, could be I'm Italian, but nonetheless, I believe in it, my friend. God bless you. Keep taking that olive oil.
All right, Tom.
Thank you.
Thanks a lot for the call.
You.
Thanks
I think
for
it's
the
a
input.
great little call.
Yeah.
Too. And I believe that. And Barbara will counsel you on that.
Yes.
So, yes, there's a whole range of things.
There's a lot of things, and maybe they can borrow the book on your desk.
Oh, yeah. You've seen the book.
I've seen the book. That's a big book.
Let me tell you, I reference that book in my new book. I say that's one of the mainstays of what I do, besides talking to colleagues in the field. I am so lucky to have a wonderful mentor out in Long Island, and I'm hoping he makes out well today, who really talks to me quite a bit, and in particular about my cancer patient.
All right, and believe it or not, that is going to put the wraps on another edition of Health Watch. Again, operators standing by, and they'll be there well after we leave you at 9 o'clock this morning. 856-489-0505, 856-489-0505 is the number. And again, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Don't forget our Health Watch replay this afternoon, 4 till 5. You can hear the show again this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. And one more thing, Dr. Molly's book, God's Ingredients, TOO, My 30-Year Journey in IV Nutritional Medicine. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, get well soon, Joanne, and our nurses, Jess and Crystal. I'm your host, John DeMasi. As always, a pleasure. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9. Talk Radio 1210, WPHT. You take care.